Hello. Today we are going to talk about proper body mechanics. In this training, we will talk about 3 rules of body mechanics and tips to ensure that you, as the caregiver, have the proper tools to assist your client with their needs. Back injuries make up half of the common disorders among people who work in hospitals and long-term care facilities. Hazards that lead to injury are poor posture, out of shape, overweight condition, incorrect movement, failure to wear slip-resistant footwear, tight or restrictive clothing that inhibits movement, moving too quickly, space limitations, and not working at an appropriate height. Body mechanics is a word used to explain how humans move throughout the course of a typical day. It is the way our bodies are held while we stand, sit, lift, carry, bend, and sleep. Back issues are frequently caused by poor body mechanics. When we don't move correctly and safely, the spine is put under abnormal forces that, over time, can cause injury, unneeded wear and tear, and degeneration of spinal structures like discs and joints. As a healthcare professional, it is critical to use proper body mechanics for a variety of reasons. First and foremost, it is critical to use proper body mechanics in order to avoid injuries to both the patient and the provider. Healthcare professionals, particularly those who provide direct care to the patient, are on the front lines. Something as simple as offering an arm to help stabilize a patient can have disastrous consequences if proper body mechanics are not used. A task does not have to be heavy or seem difficult to put us at risk for injury. Many injuries occur because of the wear and tear of poor body mechanics on our bodies over time. Proper body mechanics are vitally important for keeping your spine healthy. It's easy to incorporate these principles into daily life. One of the most important things about body mechanics and posture is alignment. Alignment refers to how the head, shoulders, spine, hips, knees, and ankles relate and line up with each other. Proper alignment of the body puts less stress on the spine and helps you have good posture. When lifting an object, avoid bending and twisting at the same time. Instead, face the object and bend at the knees, not the back. Before lifting, move close to and directly in front of the object. Make sure your feet are flat on the floor and shoulder width apart. Bend the knees and lift smoothly. Use the same movement when putting the object down again. Avoid overreaching. If you must reach up to a high level, make sure you are standing on a firm, level surface. Avoid standing on tiptoes. Not only is this an unstable position to stand in for prolonged periods of time, it can place unnecessary strain on the back and neck. To keep proper alignment, avoid the following positions or movements: having a slumped and head forward posture, bending forward from the waist, twisting of the spine to a point of strain, twisting the trunk and bending forward when doing activities such as coughing, sneezing, vacuuming, or lifting, and anything that requires you to reach far. An example is reaching up for an item on a high shelf, which also could cause you to lose your balance and fall. The base of support is the area defined by the parts of the body that are in contact with the supporting surface. The feet are the foundation that supports you when you stand. The wider the base of support, the more stable it is. Before lifting, pushing, or pulling, widen your base of support by spreading your feet shoulder width apart. Place one foot slightly in front of the other to improve balance and reduce the risk of injury. Keep your body centered over your feet to evenly distribute your weight. In body mechanics, the center of gravity is the center of weight of an object or person. It is the point where the most weight is concentrated. Lowering the center of gravity improves stability. This is accomplished by bending the knees and bringing the center of gravity closer to the base of support while maintaining a straight back. The foundation of stability is a broad base of support. The larger the base of support, the more stability you will have while moving and/or lifting. Carry objects close to your body to bring their center of gravity as close to your center of gravity as possible. To lift a heavy object from the floor, spread your feet shoulder width distance apart and bend your knees. Using the strong, large muscles in your thighs, upper arms, and shoulders, lift the object and pull it close to your center of gravity and base of support. Do not attempt to lift by bending forward. Bend your hips and knees to squat down to your load. Keep it close to your body and straighten your legs to lift. Never lift an object above shoulder level. Avoid turning and twisting your body while lifting or holding a heavy object. Whenever you need to support a client's weight, you can protect yourself by assuming a good stance. If the client starts to fall, you will be in a good position to help support him or her. Never try to catch a falling client. In the event of a client falling, you should assist them to the floor or a level area. If you try to reverse a fall in progress, you will probably injure yourself and the client. Do not try lifting someone on your own. You risk injuring yourself and them. Anytime a task requires bending, you should use a good stance, bending your knees to lower yourself rather than bending from the waist. This allows you to use the big muscles in your legs and hips rather than straining small muscles in your back. If you are making an adjustable bed, adjust the height to working level. If you are making a regular bed, you may need to put one knee on the bed, lean, or even kneel to support yourself at working level. Avoid bending at the waist. Here are some tips you should always keep in mind. Keep your back straight. Squat instead of bend. When standing for long periods of time, stand with feet apart and one foot slightly forward. Use both arms and hands when lifting, pushing, pulling, or carrying objects. Hold objects close to you when you are lifting or carrying them. Push, slide, or pull objects rather than lifting them. Avoid twisting at the waist. Instead, turn your whole body. Your feet should point towards what you are lifting. Never attempt to lift an object or a client that you feel you cannot handle. Use assistive devices only if properly trained in their safe use. Always tell patients what you are about to do and how they should assist you in the procedure. Always perform a patient risk assessment or mobility assessment prior to using any assistive devices. And use proper body mechanics when using assistive devices.